Hello, this is Dr. Clayton Bell from MetaMedical. I just want to thank each and every one of you for making our first 9 months of MetaMedical so massively successful. I never could have imagined when the hurricane came through last year and these wheels got kicked into motion a little earlier than expected that I'd be sitting here at the beginning of August just having such an amazing experience as a physician. This is what I always dreamed of to do in functional medicine. And yeah, you've made it possible. So I just really want to tell each of you how much I really appreciate you. And as a token of that appreciation, I'm enrolling everybody that's currently a member of MetaMedical and everybody that joins the next week. So if you want to get your family members on board or friends on board, tell them to go ahead and just register for an account. Even if they don't have an appointment set up yet, that's okay. Just them having an account, I can lock them in the system. And what we're going to do is we're going to continue the legacy pricing for my appointments with everybody that's already registered, so nothing's going to change for you. But I just wanted to give you a heads up. People that are joining the clinic after August 8th will be paying a different price point. So that's all on the internet and everything, but I just wanted to make sure if you saw that you knew that everything's exactly the same for you. One of the reasons that we're making some of these changes is we have a lot more administrative and organizational I guess bandwidth, capacity, overhead now. So I got so busy, I needed to bring on some additional help. So in June, I actually hired several new employees. Instead of just being Jane, Sim, and myself, of course, Jane is our wonderful medical assistant who's also a pharmacist, and she's just amazing. I know you've all worked with her. But I also hired an incredible nurse practitioner named Christina Cadden. Now, Christina is licensed in multiple states, and she is really our thyroid and hormone guru. So if that is your forte that you're looking to seek medical treatment for, and she's licensed in your state, I would actually recommend you see her above myself. We also hired on a physician assistant named Cullen, and Kyle is from Tennessee. So Kyle has a lot of extensive background with emergency department medicine. So he's really good. He's even going to offer some urgent care appointments online, which is just incredible. Super, super great benefit for our patients. And he also really has a big interest in like cardiovascular health, longevity, those type of things. But Kyle just joined us as well in June, and Kyle's located and based for patients in Florida and for Tennessee currently. And then we hired a nurse too. So I had feedback from several patients saying, hey, Dr. Bell, sometimes we can't get a hold of you via phone or message, what have you. It's like, you really need to get a nurse, and I listened to that. And so we did. We added a nurse. So we have Chelsey Wines, who I worked with previously, so some of you might already know her as well. And she is also our RGCC point person and the person that draws most of the blood for RGCC, at least locally for us, as well as the SOT or the Q restrain infusions, whether that be for cancer, gene silencing therapy, or for like the tick-borne infections or viral infections as well. And so Chelsey started with just a couple hours a week, and it's already growing quickly. And so, yeah, these are just some of the changes and growth that we've made. And I want to just truly make this the best medical experience possible that can be for you from the comfort of your own home. And yeah, so I'm really excited to welcome in our new team members, Christina and Kyle and Chelsey, and of course Jane and I are still here. And yeah, I just wanted to let y'all know too that, like I said, if you've been seeing myself and you feel like you're on cruise control right now, and you're interested in saving a little bit of money per appointment, look and see if Kyle or Christina are available in your state. And then obviously I'm here, and if they have any questions, they can ask me. But I'm typically booking out now over 2 months in advance, which is awesome. That's great. I love it. It means I'm doing a great job. We're doing a great job as a team. But that being said, I also want to offer like a price point that's available to everybody across the board, right? And then also continue to open up more bandwidth for myself to be able to see patients that continue to be more complex. More and more of my patient population now is really with like the cancer and like the RGCC cancer testing, some of the advanced therapeutics with that. As really as well, honestly, my biggest niche now truly is Lyme and tick-borne infections. As well, chronic viral infections, of course, come as part of that, part and parcel, as does mold mycotoxin exposure. So I've been doing a deep dive into that recently too. Those seem to be so interconnected, especially in this part of the country. We live in the southeast and the edge of a temperate rainforest. So anyway, I just wanted to give you all a heads up on that. I'm going to put some of this in type 2, but I just wanted to make this message available to all our current members. And I just really want to give you a big thanks from the bottom of my heart and introduce you to some of our new team who hopefully you'll have a chance to meet in the future. So thank you to everyone. So much love to everybody. And I hope you have an absolutely wonderful summer. Thanks. Bye.